So rotator cuff injuries, let's discuss that real quick. So typically the rotator cuff is made up of 4 different muscles. What those 4 muscles do is they help stabilize and support the shoulder during movements. Now, someone that may present into the office with a rotator cuff injury may have noticed, a fall on an outstretched hand, something quick, something abrupt type of movements may bring on this injury. Now, also another way to have a rotator cuff injury would be just repetitive movements. So if you do something with your shoulder every single day, if you just overuse those muscles over time, you may see rotator cuff lead into an injury. Now, someone with this type of injury may notice popping and clicking. They may notice a lack of movement in the shoulder itself, and even just pain when they move the arm in general. Now, also another key finding in rotator cuff injuries is when you try to sleep on that side, that shoulder, that tends to really create a lot of pain. So that's something that we see a lot, and it's very common in the office. So typically in the office, the treatment for the rotator cuff would involve, your typical chiropractic adjustments. There's been some research pointing to the adjustment of the mid-back can also affect and improve the rotator cuff. We'll also do a plethora of soft tissue work. So we'll do some myofascial release, we'll do some cupping, we'll do some Graston or some instrument-assisted scraping, as well as possibly some dry needling if it needs it. The research also kind of pointing more towards exercise is very good for this type of injury, so we tend to induce and utilize exercise in the gym to improve and speed up the recovery period for the rotator cuff. All right, so first what we're going to start with is myofascial release. So in our office, it's considered ART, it's just active release technique. So what we'll do is we'll just shorten the muscle and then move it through its range of motion. We'll work here on the supraspinatus first, which is just one of the 4 rotator cuff muscles. And then we'll work on the infraspinatus. Nice. Good. And we'll move to the teres minor. Nice. Okay. Then we'll work a little bit on the upper trap and the scalenes here. Excellent. So all this is doing is just kind of helping release some of that muscle tension around the area. Just kind of getting a little bit of blood flow moving into the muscles, as well as just stretching out some of the tension. Okay, so next what we're going to do is we're going to adjust the shoulder. So what I want her to do is hand on the hip. And all I'll have her do is push back pressure here. Good. Okay. Next, we're going to check the AC joint. Nice. Good. So all that's going to do is just make sure that the joint itself, the GH joint and the glenohumeral joint, as well as the AC joint, is moving like they should be. Sometimes when we get this rotator cuff injury, it tends to tighten up a lot of the musculature around the shoulder, and then we tend to lose that motion into the shoulder as well. So that's what those 2 adjustments are going to do.
So along with adjustments of the glenohumeral joint, we also like to make sure that the SC and the AC joint are moving as well. So we're going to find the AC joint, just make sure we get some proper movement into there, as well as the SC joint. So part of the shoulder girdle, there's also a joint that connects that scapula to the thoracic spine. So we want to make sure that the thoracic spine has good mobility as well. So an adjustment to the mid-back is definitely part of treatment.
All right, guys, so what we're doing here, we're just palpating for the rotator cuff musculature. Typically, when a rotator cuff gets irritated, it's most of the time the supraspinatus. So what we'll do is we'll just find the spine of the scapula or the shoulder blade. Typically, that supraspinatus originates right on top of that spine. So what we'll do is just find the spine. Grab and stab is the technique. So find the spine, get the needle into the actual muscle belly itself, right there. Perfect. We're gonna do one more. Perfect. Okay. So next what we'll do is we'll just hook up some E-stem to it. All right. And then what I want you to do is I want you to tell me when it's strong but it's comfortable, okay? The muscle's gonna start jumping a little bit here. So what we see here is we see the muscles jumping, okay? And what that's doing is it's just contracting and relaxing that muscle. So over time, after doing this for about 5 or 10 minutes, then we get what we consider muscle fatigue, and it just kind of relaxes some of that tissue, some of that muscle. It also helps, in this case, with an injury, because you're getting muscle movement. And as the muscle moves more blood flows into the area, speeds up recovery. Anyone that may have a rotator cuff injury, or yourself may have a little bit of an injury in the rotator cuff and the shoulders, we'd love to help. We'd love to have you get into the office. We'd love to take a look, examine it, run it through some tests to kind of really determine if it truly is a rotator cuff. And if so, we'd be happy to help. So give the office a call at 513-463-3011, and we'll talk to you soon.